Today we'll talk about robotic surgery and the benefits associated with it, as well as some of its limitations. It's really important that you not only look at the benefits but also the limitations to make sure you understand them appropriately and how they affect a surgeon's approach to your particular disease process and how that relates to the benefit that you get out of it. So clearly, the robot uh, has has many benefits. In fact, one of the major benefits of utilizing the robot while performing surgery is better visualization. The robotic camera is a three-dimensional camera, so you get a better perception of depth while you're operating within the abdomen or any other location within the body. So you get better depth perception. Also, it's a camera that is very stable and steady. So you can take the camera and put it right next to the tissue and be able to visualize it on your monitor 4 inches away from your eyes. That which is much better than laparoscopy, because laparoscopy you can put the same camera in the same location within the body, but the actual monitor, the TV screen, is usually a good 4 to 6 feet away from you, as opposed to 4 to 6 inches away from you. So you get better depth perception, you get better visualization. Now for intricate surgeries, there clearly could be a benefit to that. The other major benefit of robotic surgery is you get better and more degrees of freedoms as opposed to laparoscopic surgery. What that means is that the instruments that you're utilizing in the robot, they're wristed. So if I were to give you an example, in laparoscopy, most instruments would be as such. They would go in and out of wherever they need to go. They would rotate, they would open and close. The robot, because it has many gears and such within the instruments that are easier for the computerized systems to manage, allows us to not only do this, but also this and that and this. So you get more degrees of freedom, even more than a human wrist. And the robot for now does exactly what we ask it to do. So it's not making any decisions, and we control it, and mostly we can control it very safely. So there are definitely benefits in better visualization and being able to do more complex maneuvers in difficult to reach places, which is why robotic surgery is taking off in a variety of fields. Now, the negative parts of robotic surgery, I put them basically into two different categories. The first is you don't get sensory feedback as to how much pressure you're applying, how much pressure your instruments are applying. What that means is, for example, let's say I was doing laparoscopy and I have an instrument that's a laparoscopic instrument with my hand at the end of it. If I were to touch something, hit something, my hand would feel the pressure of something hitting something. That's called haptic feedback. Whereas with the robot, I'm sitting at a console, and as I'm maneuvering these instruments, the instruments may be hitting things on the inside, but not giving me the same kind of feedback that, hey, there's something here, or you're putting this much pressure, maybe you don't want to do that much. So for example, let's say we had a paper cup full of water, and you just wanted to go ahead and grab it and lift it up, and that feedback of feeling how much pressure you're putting on that cup can be very important. Now, once someone has had extensive experience with robotics, you can then you can use your visual perception to help judge how much pressure you're applying, which most of us do, but it's not the same thing as actually feeling how much pressure you're applying. So you lose a sense, and your other sense becomes a lot better. So keep that in mind. The other issue is, most often robotic surgeries do take longer time under anesthesia to perform. The actual surgery time may be shorter because it's easier to manipulate those instruments. Once we get started operating, we may actually spend less time operating to do the procedure. However, it takes a while usually to get the robot set up, and so overall time under anesthesia tends to be longer. So if an individual, a patient, is high risk for anesthesia but needs an emergent procedure, or a procedure of a life-saving nature for oncologic reasons, you have to weigh the benefit of the robot versus prolonged time under anesthesia for perhaps a individual in his 80s with bad kidneys and a bad heart. So all of these things need to be taken into account and considered when making a decision as to whether to perform a surgery the standard way with a large incision with laparotomy versus laparoscopy, which is becoming the standard nowadays for most procedures with small incisions, versus robotics. So laparoscopy versus robotics, there are benefits to both, and I would ask you to discuss this in detail with your physician. And if your physician is offering both options, ask them how either option is beneficial to you and how it may not be before you decide which way you wish to proceed.